Good day everyone, how are we doing? This is Dr. Aderemi from Mom Health Parenting YouTube channel, and today I'm going to be talking about something very common, something a lot of women have asked us about. I'm going to be talking about fibroids. These are growths in a woman's womb. They are usually benign. What I mean by benign is they are non-harmful growths. In fact, they are very common. A woman can go ahead and have her children, see her grandchildren, live her life to the fullest and have a fibroid and not know about it. Fibroids are that common. Nowadays, with the advent of scans, you go to the clinic, you do an ultrasound scan, and it comes back, oh, you have a fibroid. A lot of women are more aware of this condition, but it is generally harmless. There's nothing wrong. A lot of women have this. A lot of women have fibroids. A lot of factors contribute to fibroids. A lot of factors, scientists are still doing a lot of research about it. For instance, age, parity, how many children you've had, as well as diet have even been linked to fibroids. But I'm not going to talk about the causes. What I want to discuss here will be majorly about the symptoms, about how it can affect fertility, and then later on in our next video I'll talk about fibroids in pregnancy. So as I said earlier, fibroids are very common. They are growth in our womb. They are harmless. They usually cause no problems. But they could also cause problems, and this depends on their size and on their location. There are different parts of a woman's womb. Our uterus has different parts, and some certain fibroids are in certain places that don't cause any issues at all. What I mean by this is that the baby can go ahead, implant into the uterus. Baby can pass through the birth canal easily. So throughout pregnancy, throughout labor, the woman has no symptom whatsoever that is linked to the fibroid. However, some fibroids, depending on their size, can then cause symptoms. For instance, some fibroids are really large. They could cause bleeding. What I mean by bleeding is that during a woman's menstrual cycle, when a woman is menstruating, the blood she's producing is a lot. A woman can call us, oh, she has menstruated, and her part, she has used like a whole full sanitary towel. We call this menorrhagia. It's a lot of bleeding throughout your menstrual cycle. In fact, some women will have bleeding in between. I mean, they are not menstruating, intermenstrual bleeds, and then they see blood. Some women will have bleeding or blood during sexual intercourse, have pain during sexual intercourse, have bleeding even post-sexual intercourse. So fibroids can cause this. Another thing is, depending on how large the fibroid is, it could impede on it could compress on your organs. What I mean by this is that I've seen a woman who told me that the toilet in her office is not too far from where she sits down, but she always has to get up, always has to stand up to urinate. This is because the fibroid she has is pressing on her bladder where the urine is stored, and she has urgency. She needs to stand up, she needs to pee. So yes, fibroids can affect our urinary pattern, even our stooling pattern. It could even affect our breathing depending on how large it is. So fibroids can cause pressure symptoms. They could cause pain, they could cause bleeding. Another thing is fibroids can affect fertility depending on their location. They could stop the implantation. What I mean by this is that you have the sperm and egg, they've come together about to form a baby. They could impede where the baby is being formed, that's in the womb. It could also cause the baby could implant successfully and then subsequently miscarriages, because the fibroid and baby, they are busy competing for that space. I think I want to make it that simple. And then recurrent miscarriages, premature labor, all this I'll discuss in our next video, fibroids in pregnancy. So how do we manage fibroids? If you have a fibroid, it's important for you not to worry about it. As I said, it's very common. But if it's impeding on your day-to-day functioning, cosmesis, you think is too big, it's affecting your breathing, it's causing bleeding. In fact, some women bleed to the point where they have low blood volume. All this, you then need to seek help. See a doctor. There's medical therapy, surgical therapy. There are different ways we can manage it. So it's important for you to see a physician and seek help. Thank you very much.
Thank you very much. Please don't forget to subscribe, don't forget to like, and don't forget to share this video. Also, hit the notification button to get more videos like this. You can also visit our website at www.momhealth.com.ng for all maternal and baby products. Guess what? We have a 10% discount for you for all purchases made on that website. Another good news we have for you is you can also visit Google Play Store and download the Mom Health mobile app to explore all our amazing features. Thank you very much.